My name is Notidua. We're looking at the health sector, and what specifically is the tail of the tape. You just heard speaking private medical practitioner with extensive experience, Dr. Yao Osafo of the Medicas Hospital. We also have with us Dr. Aaron Abosi. He's a lecturer at the University of Ghana Business School. He specializes in health management. Honorable Robert Kugana Blem, Deputy Ranking Member, Health Committee on Parliament and MP for Binduri. And next I'm going to be speaking to Kelvin Odonko. He's a nurse and CEO of GhanaHealthNest.com, a blogger as well. Kelvin, you're welcome.
Thank you.
Right, as a nurse, I'm sure there were aspects and menu items in this manifesto that must have attracted your interest.
I mean, the everything in the manifesto was very attractive, and until now, I'm getting some awakening that a lot of them needed quite some strict questioning. I mean,
you were asleep for 23 months?
I'm sort of. So
now you're coming to some realization.
Believing that, I mean, this will progress into transforming other areas.
Okay.
Especially when you look at the aspect of, since I'm a nurse, I'll start from the nursing allowances.
Okay.
Could it have been the reason to improve best practices in the nursing field? Was it the best way to retain nurses? Because believe you me, in this year, 2018, we're having quite a number of nurses who are moving out of the country because the UK is enabling processes for nurses to move out of the country to go. We have a chunk of nurses at home who don't have work to do. And the UK NMC is saying that if you have not even practiced for any amount of days, as it used to be that you have to practice for maybe a year or two before you can come and work there. Now UK NMC is saying that you don't need all that, just come straight. So they are enabling the processes for nurses to move out of here to go and work there.
And we are not.
And we are not. We still have quite a number of them at home, and some have resorted to working in the markets and what have you.
So this restoration of allowances hasn't done anything?
It hasn't done anything. The nursing agencies have also not been bold in, having a clear path in saying that this is what will work, this is what will improve nursing practice. Case in study. Now we have this clinical assistant, and anybody speaking on this matter has to be bold.
Right.
In the sense that resources is going to nurse assistants.
Right.
Then we have still the general nurses, the expansion. We have not seen much expansion for them.
In this instance, we're talking of nurses who have qualified and are in the profession, or?
No.
Trainees?
Under training, okay. Because these allowances were for those in training.
Right.
So we are having a situation where we are expanding nurse assistants, the training. Whereas when you look at the document that was binding this whole training thing, it was looking at having a number to support the nurses in the field.
Okay.
And when they reach that threshold, they would have to stop. But then earlier this year, there was a letter that came out that they have actually stopped training and they will rather upgrade, because when you upgrade people in the knowledge base, definitely it goes a long way to improve the practice.
Right.
But then a letter comes out and then it's withdrawn. So
there's some confusion in policy.
There is a confusion in policy.
Right. Let me just ask you this, Kelvin, before you go on to another point. As a nurse, when you heard these things, right, if you had a wish list, was this restoration of allowances your biggest priority? As nurses, it was made to seem to us that this is something that is killing, can I use the phrase, demotivating nurses.
Exactly.
So it was the bait.
Exactly. I took allowances whilst I was in school.
Right.
But if you ask me, and I have to be sincere, we wouldn't need allowances to keep nurses in school. Okay. Because then, I remember when I was going to nursing school, I picked up forms for free. And before me, I remember that they were inviting people to come and learn.
Right.
To be trained as nurses.
Okay.
But these days, the number have shot up. So could there be reformations in it? If we are increasing the skill set, definitely the diploma level may have to be upgraded, because now when you are doing your post-basic programs, it has even been pushed to a degree program. So when you finish school and you want to do a post-basic program, it's a straight degree. So then, why do we still have to continue what we were doing 10 years back, 12 years back, without having changed much, and expect best practices or practices to improve in the hospitals?
Okay. There's been some change as well. The restoration of allowances in the manifesto, which has been actualized, was to, in a sense, increase access. So get more numbers in there. But then there was also a directive that said that the training institutions should cap the number of trainees they are taking.
So when you go to my training institution, I look at the figures that this time around, the numbers have been dropped down.
So we're losing.
But the point also is the demand for healthcare services is also shooting up because the population is increasing.
Right.
Diseases are transforming. The conditions that we used to take care of, I mean, things have changed. Okay. So we need much more numbers to do what we call the patient to nurse ratio, the midwife to pregnant mother ratio, the psychiatric nurse to the over 5 million psychiatric patients who are seriously ill and do not even have access to mental health facilities. So we need more than to be capped. So if the allowances is the issue, drop it off. Pull in much more of the nurses for the training. Are
you advising the government to drop this
I am thinking, allowances? I am of the
belief... You're thinking it's not the priority?
I am of the belief that if the allowances is limiting the numbers that has to come in to support the system, then we will have to look at it again. Okay. I will also want to quickly touch on the universal health service...
coverage.
Yes, universal health coverage. And of course, it encompasses the fact that when people need health care, and from the manifesto, the health system must be responsive. And we've been exposed badly with this no-bed syndrome. And one would ask, why did the manifesto even say that there should be an emergency center placed in Takoradi? When Accra does not have an established emergency system where health facilities are unable to communicate with each other. I mean, one would have just think through that. I mean, why was that mentioned that we are going to have? And now we also have the situation whereby private facilities were going to be partnered in a way to establish emergency response systems. Right. Whilst these emergency response systems are supposed to be manned by emergency practitioners.
EMTs and other things,
But where are they?
Right.
Where are these practitioners?
So you don't see anything in policy direction or actually implemented policy that shows you that we're building the manpower and we're building the system to meet what we stated or what was stated in the manifesto?
There is a lot of confusion. I mean, when you go out there, apart from this Astana declaration, apart from the fact that Norway, Germany, Ghana had some sort of commendation for having stood up for global health, universal health. I mean, you hear all these accolades on the global health front, but then when you come back home, the system is very confusing. You understand?
Okay.
It's the reflection does not meet what is being said there.
Okay.
When you look at technology, the fact that we must have systems where we can be able to make simple diagnostics. Today, you can walk into big health facilities and they can't even check for some, they can't even do some lab investigations. And a lot was said about
telemedicine and the use of technology in the health sector.
I'm even not going there. Even in the diagnostics, you have to still let patients move out of the very big hospitals to private institutions to go and do their lab tests. MRI machines are breaking down almost every week.
Okay. Wow. So this is coming from Kelvin. He's a practicing nurse. Good one at that.